And if you visit my clinic downstairs, you'll see that out of 40 patients that I see, about 25 come in with fever. If one child has got an infection, it's very likely if the child expresses or expectorates like coughs or sneezes, the viruses will circulate in the room. So that is how we get a cohort of children from one nursery or one school with multiple problems. Children get lots of rashes in their mouths. It's quite painful. Some of the lesions look like chickenpox, and hand, foot, mouth is very easy to treat. So what we tell the parents that if your child has it, don't send your child to school because it's very highly contagious. Good afternoon, everyone. This is Dr. Niloy Mitra. I'm a senior consultant pediatrician and neonatologist at Neotia Bhagirathi Women and Childcare Center in Newtown. So today we're going to talk about fever in children in monsoon. Remember, monsoon in India, particularly in the part that we live in, is 4 months of the year. So June, July, August and September. We are coming to the end of the first half of the monsoon. And if you visit my clinic downstairs, you'll see that out of 40 patients that I see, about 25 come in with fever. And the problem is that there's no quick solution to this problem because it's a seasonal influx of patients with fever. And we usually see 4 main categories: viral, bacterial, and of course, the seasonal flu type illnesses. Of the viruses that we usually encounter this time of the year, it's mainly dengue, which luckily for this year, we haven't seen very many cases, but we have seen a few. And what we have though seen a lot of is the usual viral flus. So H1N1 type, which is also called swine flu in some countries, and also the H3N2 types. Besides these, we are also getting lots of other viruses like enteroviruses, adenoviruses, and so on. Our hospital is state-of-the-art, and we have the technology to pinpoint the viruses that children suffer from. For example, today I had a child who had a lumbar puncture for a fever lasting about 7 to 10 days, and we found that it was enterovirus in the cerebrospinal fluid. So that's just an example to let you know that the myriad types of viruses we get this time of the year, because of the increased humidity and the amount of moisture in the air, is very difficult to bypass these issues. The other problem is children attending school from an earlier age. So usually about 10 years ago, children used to attend school from 2.5, 3 years onwards. Nowadays, they attend school from 1.5 years onwards. So the influx of infections in these children has gone up. The other problem is closed air-conditioned environments. So most modern schools have gone into air-conditioned environments where the doors are closed, and children, say about 25, 30 of them, are in an enclosed space of say about 100 square feet, where if one child has got an infection, it's very likely if the child expresses or expectorates like coughs or sneezes, the viruses will circulate in the room. So that is how we get a cohort of children from one nursery or one school with multiple problems. Next, let's talk about malaria. Malaria is also common this time of the year because of waterlogging, and so is dengue. As I said, dengue hasn't been that much of a problem this year as of now. We are already the half end of monsoon, and the second half is now left. We are going into the second half. Malaria cases, we haven't seen a single one as yet, but we are expecting a few in the days to come. What we have though seen is hand, foot, mouth disease. We've seen about 150 cases in this hospital in the last 1 month, which is quite a lot. And there's a cohorting of this particular problem. Children get lots of rashes in their mouths. It's quite painful. Some of the lesions look like chickenpox, and hand, foot, mouth is very easy to treat. So what we tell the parents that if your child has it, don't send your child to school because it's very highly contagious. Follow your doctor's advice, and child will eventually get better in 3 to 4 days' time. So how do we prevent these? Well, number one is local hygiene around your home. So make sure there's no waterlogging near your home, there's no stagnant water, and make sure you use mosquito repellents. And when your child is leaving for school, you can use something called roll-ons on their skin or also on their clothes. When you are at home, particularly in dawn and dusk, this is when mosquitoes are most active. Make sure you use repellents at home. And if you're on the ground floor, then make sure that you must have a screening net to keep the mosquitoes out on your windows and doors. This is very, very important. Next is vaccination. We have got an excellent vaccination set up here. Please get your child vaccinated. It's very important. And get the vaccines done in about May or early June before the monsoon sets in. It's very important to get your flu vaccine yearly in every child right from the age of 1 year onwards. So the first year of life, we give 2 vaccines. From the second year onwards, it's 1 yearly flu vaccine. And please make sure the new vaccines that come into India, the Northern Hemisphere vaccines, they come in around end of May. So please make an appointment with a pediatrician here, get your vaccines done here, and get it done in end May, early June, so that your child is protected for the ongoing monsoon flu season. Number 3 is school attendance. It's very important that your child gets educated and goes to school, because school is important for socialization, for education and so on. But ensure that if your child is not well, has fever, has a rash, ensure your child sees a doctor, and please stay at home till your child gets better, because it's a social responsibility to keep your sick child at home. Otherwise, you'll be spreading the virus to other children as well. And lastly, most important, please ensure to see a doctor. Don't do self-treatment at home, because we see about 30% of our patients who have been self-treating at home. Some of them even go and get blood tests done on their own. Don't do these things. Please come to us. We are here to advise you. Our OPD is open 7 days a week. We have got enough slots to see more than enough children. And get your child seen first before you self-medicate your child. Don't take antibiotics unnecessarily, and don't give ibuprofen type drugs without seeing your doctor, because all these can harm the system and can cause actually more harm than good. So please see your doctor, get advice and follow their advice rather than self-medicating yourself. Thank you very much. I hope your children will remain well for the rest of the monsoon. Another 2 months to go. But we do see a very large number of children in these 4 months of the year with illnesses, particularly fever of unknown origin or otherwise. And last one point is, if your child goes out to play, particularly in swimming pools or in the fields and so on, we have seen in the monsoon an increase in bacterial infections as well. For example, chigger mite bitten diseases like mite-related diseases, and also sometimes typhoid. So make sure your child is vaccinated against these diseases as well. And if you're out in the monsoon, make sure your child has full-sleeved clothing, proper shoes on, so that there's no bites from leeches or mites and other insects. So these are also very important to note. Thank you very much. I'll end my speech. Thank you.